we will have on the stage building continuous improvement DNA in healthcare with the team from Singapore. So please, Dr. Angelina Tan.
Thank you, Chris. Hi, everybody. I'm Angelina from the Singapore Institute of Technology, and together with me, we have Mrs. Chiu Hui Tiang, the Senior Advisor of the Kaizen Office from Yishun Health, as well as the Senior Advisor of Singapore's National Health Care Group, Board of Advisor. So before we begin, I'd like to share a little bit about Singapore Institute of Technology. Okay, so we are Singapore's University of Applied Learning, and by size, we are Singapore's third largest university. We really pride ourselves in being that connecting bridge of students to the industry to make sure that all applications and things that they learn in our university have an application to the industry when they go out to work. So our Ministry of Education said this, that's important for universities to remain attuned to the evolving industry needs. So we need to co-develop training programs together with our industry partners and not in silos and expecting them to join in. So today we really have built up quite a big network with our industry partners, trying to train their workers. So Yishun Health is a good example of that. So within Singapore Institute of Technology, we have our National Centre of Excellence for Workplace Learning, and this is funded by the government. It's an initiative to build workplace competencies in organizations. And we come up with a learning enterprise model that I would like to share with you today, where we work on existing business challenges in the organization. So lean coaching and lean training takes place in the actual work environment so as to minimize work disruption and also let the employees see that as they build their capability, they're solving issues and problems at their workplace itself too. Expanding a little bit on the learning enterprise model, right? The first step is to identify the needs of the enterprise. What problems are they trying to solve here? And can the learning achieve the expected business outcome and performance that they are looking at? And next, in the second step, we establish what success looks like. So this allows the identification of learning gaps of the enterprise in a bid to develop the employees' capabilities. Thirdly, a training plan is also established. It ensures that there's continuous improvement built into the plans itself. So lastly, learners will be assessed on their applications of their learnings and compared to the desired outcomes in step 2. So tweaks and standardizations of trainings will also be made thereafter. So if you're familiar with Lean, this model really sounds like that whole PDCA cycle that we advocate in Lean, with the enterprise at the heart of learning, hence developing Singapore's workforce. So employees are empowered to leverage on their workplace to learn and build their capabilities. So we have this structure of our workplace learning programs, and when we designed them, we wanted to make sure that as we teach and impart Lean skills, companies are able to apply them to the actual workplace. So we have that first phase of training and scoping of that project, where that's knowledge transfer of all the Lean skills and Lean information, right? And then we have that second phase where we do skills application. So we will go down to the company, pick out and scope out the problem that the employees can work on, and then we'll coach them on the whole A3 thinking in order to solve that problem. So after the program, they'll be able to embark on their own Lean journey and their own Kaizens, whether it's small or bigger scale with other departments as well. So the whole idea is to build that kind of capabilities within the workforce. So in order to scale this up, because we are a university, we embark on this model called a Queen Bee. So we have Queen Bee partner companies along in Singapore. And an example is Kwong Wai Shu Hospital in the community care space, where it's step-down care and long-term care. So what we do with Kwong Wai Shu is we train them internally. We do organizational transformation, and we have train-the-trainer programs and make sure that the organization is lean, and then they replicate it to other organizations, such as other community care organizations, as well as their value chain partners. So in hope of having sector transformation within the community care space. So we do this for various industries, and industries that we are partnering with range from healthcare to social service, food manufacturing and services, engineering, as well as hospitality. So Yishun Health belongs under healthcare, and Yishun Health has a network of medical institutions and health facilities in the northern part of Singapore, under the National Healthcare Group, and it comprises of an acute hospital, a community hospital, and a medical center. So today we have Mrs. Chew, the former CEO of Yishun Health, one of the pioneers driving lean healthcare in Singapore within Yishun Health since its establishment. Mrs. Chew is currently the senior advisor to Yishun Health Kaizen office, driving Kaizens all throughout the system, as well as the senior advisor to Singapore's National Healthcare Group. So without further ado, I'll pass it over to Mrs. Chew.
Thank you. Thank you, and good morning. Thank you for the opportunity to share our experience and on the journey of Kaizen, which started since 2006. There was a time when I was the Chief Operating Officer in a small hospital, Alexandra Hospital in Singapore, with 300 beds, acute general. When we first started in that hospital, the challenge thrown to us was to improve service quality. The team went out to visit healthcare institutions and non-healthcare organizations like Ritz-Carlton, Singapore Airlines, Toyota, and many others. And there were two books that I read personally that really changed my life and perspective. The first one is the Toyota Way. The second one is The Machine That Changed the World. After several years of experimentation at trying to solve the problems in the hospital, we realized that, and experts also confirmed, that hospital healthcare is really, really very complex, and our processes are very, very tightly coupled. The care environment in healthcare is a high controlled one. We are controlled by regulatory requirements, care standard of practice professionals, service quality, policies, and a lot of protocols and instructions to guide the healthcare workers on how they would do their work. Yet, in the front of where the patients are at what we call the sharp end of the interface with patients, really, our frontline workers are faced with a lot of challenges. Healthcare services demand is increased, especially after COVID. The workload is just incredible. And they are faced with care fragmentation, care variability, process variability because of the transfer of work from team to team, shift to shift. And people variability is one of the greatest problems we have to face because we have professionals coming from all walks of all countries, nationalities, and they are practicing in different roles with different perspectives and, of course, with different styles of communication. And in the front line, the staff has to respond to unexpected situations, and their response really may very well all the time, in fact, be very unplanned. With the experience that we have and the learning from many organizations, we put together a framework in this house which has 10 elements. The foundation of the house, the first foundation we have is based on our care philosophy and our service basics. And here we actually share with our staff so that we have a common language and a common mission that we want to achieve for Yishun Health. The foundation 2, 3, 4 focus on the way we work. And here we learn how to look at processes, standardize them, simplify them, and level workload as well. On the two sides of the house, the two pillars, one is what we call visual management. And we feel that making problems visual is very important so that team members can have a visual of how the problems they are solving together based on data and statistics they can gather. The other side of the pillar is on science. Our mission statement says that we want to provide good quality healthcare, affordable healthcare, hassle-free healthcare with science, love, and wisdom. So science is very important to us because in the professional world, doctors and nurses look for evidence-based care. We have tools in that science column where the toolbox where we bring courses to the staff. It could be PDCA, it could be Six Sigma, it could be design thinking, it could be analytics, it could be human factor engineering. Right in the middle of this framework that we have, of course, is the most important thing, and that is our people. That's the heart of the matter, and that's where love and wisdom is. Wisdom to reflect on what we are doing and improve on it, and the love that we have for our patients and our staff. L.O.V.E really stands for listening to our patients, to our staff, offering help to them based on the values that they want delivered, and to engage them in the solutions. So this is the summary of the important elements in our framework. Now, to manage that service mission and to manage continuous flow in a hospital, we need to first know what the patient value. Patients come to hospital for diagnosis, for treatment and advice, but unspoken, and we have interviewed many thousands of patients throughout the years, and they have always told us, please respect us, disrespect our dignity, give us information, care for us, so that you can integrate care and services for us, give us good, very consistent quality care, and of course it must be cost effective. This value guides us in all the processes and flow that we design in the hospital, because as we develop the flow for the patients, for the family and the providers, for information and for materials like medication equipment, we really want to eliminate the waste, and we have learned about the 8 waste that has to be removed in order for the flow to happen. In the heart of the house is our people, and here the important thing is we need to understand what our people need. So engagement with our people is key. In every functions, in every celebrations or debrief of a project, senior management is always there to engage with the staff to see what support they need. Besides that, we have also learned over the years that healthcare people are very good at looking after patients, but when it comes to their own health, they really don't pay enough attention. So as an organization, we have set up a health promoting hospital with facilities and programs to help look after the physical, mental, and social health of our people so that they can go on to help the patients. In terms of investments in capability of our people, we bring to them the courses that they need. And our collaboration with SIT is one of this initiative that we have. Our staff share with us their efforts, their problems in platforms like huddles, roll calls, and in meetings with us. But one of the most important platforms, and they enjoy that a lot, is a Kaizen Festival that we organize every year, where we invite external experts, speakers, and colleagues from other institutions to share their journey in terms of improvement. And here at this platform, our staff also have the opportunity to showcase what they have done for the patients. Every year we get about 200 well-written kind of process improvements that they want to share with us. And at this platform, we give recognition to individuals who are champions of Kaizens, and we also give awards to nurturers, the supervisors, the managers, and the head of departments who support their staff while they solve the problems. At the department level, we also give recognition to departments who are able to sustain the culture of Kaizens. Here you see a bronze and a silver. For the last 10 years, we have not given out a gold award. And it says there's something that we are still looking for that is not available, that we do not see. And until we see that culture and the visual evidence of it in the department, we have been holding back that gold award, and it's quite tough to get that award. Now, we have spent many years building this culture, and in the first few years, we created a workshop called a hassle-free workshop. Hassle-free workshop means hassle-free for the patient and hassle-free for the staff, meaning we are able to provide care end-to-end with continuous flow and with eliminating the waste and helping to deliver a good service. We do that through orientation. Every new staff goes through an orientation, and they spend 3 hours in the workshop doing hassle-free awareness. Over and above that, we have in-house workshops on 5S, PDCA, FMEA, and the Kaizen in practice as well. However, with a high turnover, particularly after the COVID experience, we have lost quite a lot of staff. We realize that, number one, we need to have a continuity, a sustainability for building culture. 2, we need to invest in the soft skills. And one of the barriers to Kaizen is actually the meso level. The supervisors, managers, and the HODs who may be very strong in their technical skills, but may lack some coaching, mentoring skills, and leadership in Kaizen. So we have now partnered with SIT to help us on this next part of our journey. Now, better people will give better care. That's for sure. We have seen it time and again in the Kaizens that's presented to us and shared with us. On one corner, you see a little plastic cup there. That is to remind me to tell the story of a nurse who realized that elderly patients who go for operation, forget to bring their container and tend to wrap their dentures in tissue and left it on the lockers. And lo and behold, when the housekeeper comes, she cleared the lockers for them, and we have somebody without teeth for many weeks. This is not happening once, and apparently our staff reported that it has been happening to the elderly. And what they have done is they've gone down to the kitchen, picked up the jelly cups and brought it back. And for each patient now, they label their names and put it very clearly, it's for their dentures. And we have not had any incidents so far after this has been implemented. This slide actually tries to show you that there are many departments across the flow of the patients who are doing Kaizens. Down, there's another one you see with a guy with a Bermudas with a kangaroo bag at the side. That was designed by a staff because one of the elderly patients refused to ambulate because he's too embarrassed to walk around with a urine bag. So she went down to the linen room and got the linen lady to do a pants with the kangaroo pocket at the side. So now our friend can ambulate at the same time and do not feel embarrassed at all. This item is now available for sale in our pharmacy shops, and it's a very popular item. Now, there are too many Kaizens to share, but one point Kaizen I want to share that is very creative is a group of staff in the operating theater who has been using a computer on wheels to do their work. And when they found that it cost the hospital 2,500, they came to us and said, look, let us redesign this trolley to suit the way we work, and we will do it at a cheaper cost. And they got a local fabricator to do that at 1/4 of the price. Process Kaizen is another area that our staff looked at. And here I wanted to share a poster that is done by the professionals. As usual, when it's a professional presenting, they like a lot of data and a lot of graphs. So our A3 turns out into a poster look. But the sharing we have here is that the professionals, the nurse and the therapist, had to assess patients who usually elderly with dementia on their behaviors and whether they are capable of dealing with their activities of daily living. They do that on their own with the patient on the bed, and then they look through the nurse's notes to figure out what problems the patients are facing. The two of them now come together and decided to do that during meal times when the patient is with their family interacting and doing their activities of daily living, and the therapists observe and the nurses guide, and from there they are able to interact. They find that they got the answers they want, and they also now are able to have a happy engagement with the family and educate the family on how to take care of the elderly when they are discharged. Two system Kaizens that I would like to share, which took us more than 3 years. One is on cataract and one is on hip fracture. For the cataract patients, the hypothesis that the staff wanted to, when they came to us, was that, look, we need to have better eye care access for elderly in the communities who are going blind because they have cataracts. And instead of the mass health screening that we hold once in the blue moon, because it's so difficult to organize, logistics are very, very heavy, they decided to set up a community clinic and train the doctors, the ophthalmologists, train the nurses and the optometrists to do 2 levels of screening. And with these 2 levels of screening, they were able to screen over a short period of time, 1 year. They were able to screen 4,000 patients, and eventually 1,400 were found to have abnormalities by the screening nurse and handed over to the second screener, which is the optometrist. And the optometrist now is able to work with the ophthalmologist using telehealth and able to now identify specific abnormalities for the ophthalmologist to work on. And with this, we now free up attendances, the slots in the specialist clinic for patients who really need the care of the specialist. With the beginning of this particular project, It spins off many, many Kaizens in the eye department, in the operating theater, and in the clinics, where they worked on smoothing out the flow for patients as more and more are coming into the hospital. The doctor who did this is a Six Sigma trained doctor. We also have a hip fracture team. Now, the hip fracture team was interesting. Sorry, I'm flipping up and down. The inpatient care, we have a lot of elderly who landed up in the emergency department with hip fractures. And the doctor's intent is, can we get them to operating theater within 48 hours? Now, this started a whole series of Kaizens where they managed to bring the surgery time to 48 hours by bringing together emergency doctors, anesthetists, the geriatricians, the orthopedic surgeons, the nurses taking care of them, the pharmacists, the dietitian. And with a whole series of Kaizens, they went beyond doing the surgery time. They were able to lower the medical complication rates to international rates. And at the same time, we have a very, very satisfied and happy staff in the various units in the operating theater and the wards. The two person you see there are the people who came to us for help, the ADN and the geriatric consultants, and both of them received the Nurturer Award for helping us groom many, many teams over the 3 years. The lessons that we learned in our Kaizen journey is that, number one, we really must have a common vision of what a patient value is and articulate that in the value stream as we design the Kaizens. We identify opportunities for the improvement and not do it at one big go. Take small steps and then do rapid succession improvement on it. Do what you can with what you have. Don't go to the administrators for budget because it will be difficult and it will take a long time. And at the same time, we now learn and do and share. The role of leadership in this is to engage our healthcare workers at all levels to become problem solvers. They can do it. Empower them, develop them, and support them with experimentation and the implementation. So my conclusion is to build a culture of Kaizens. Individually, healthcare workers, they must have the knowledge. And when they have the knowledge and they know that they can solve the problem and they are empowered to serve the problem, their sense of ownership and confidence goes up. But as a team, we need the leaders to be able to have shared vision with them, to share knowledge with them, because knowledge are always improving in medicine all the time. And there must be mutual respect for all levels of staff, including a hospital attendant who may have something to contribute. And the result we want to have is a collective wisdom of all our different groups of people with a new model of care, new paradigms, and building on a culture of continuous improvement day by day, bit by bit. And I think we will get there. We are very far from it, but surely and slowly we will get there. Thank you very much for listening.
Thank you, Mrs. Chu.
Hello.
Hello.
Hi, Chris.
Hi.
Hi.
So let me just check here if we have some questions from the public for you. Let's see. Okay. So thanks. Okay. That one. Jelena. So we just have a comment here from Toniani. Matt, if you're there, if you can put on the screen. There. Not just respect, but explicitly stating and providing example of this, fashioning one patient a more modest pair of pants for the dignity along with embracing love for the patient has a value. These both stopped me in my tracks. I can't imagine how those values must impact convalescence. Beautiful. So again, guys, excellent example, sharing the knowledge, sharing the learnings. So I would really like to thank you for this presentation and for the opportunity of sharing here with us and the world part of your learnings there from Singapore.
Thank you.
Thank you.
Thank you, Chris.
Thank you.